Hi everybody, I am Srijana Shrestha and my student number is 6406877. Today I am going to present a poster presentation as a part of assessment 3 of SNPG 939 Psychoactive Substance and Mental Health. My poster presentation is based on one of the important pillars of minimization called harm reduction. Before going to the topic, I would like to discuss and put on light on harm minimization. According to Australian Government Department of Health 2004, harm minimization helps in the reduction of harm of alcohol and other drugs issue on individual, family, and community by considering health, social, and economical consequences. It has been key policy in Australian state and federal government since 1985 launch of national campaign against drug abuse and the subsequent national drug strategy. Harm minimization is consists of three pillars: harm reduction, supply reduction, and demand reduction. For my poster presentation, I have chosen the harm reduction pillar. Harm reduction is practical strategy and ideas committed to minimize the health, social, and economic harm potentially based with drug use. Some strategies of harm reduction are: it lowers the risk of HIV and hepatitis transmission for drug users by offering information and assistance in non-judgmental manner. Its reduction activities and interventions helps to improve the health and quality of life for people who use drugs and their communities. It consists of peer education, needle and syringe program, pharmacotherapies for drug dependence including methadone, voluntary testing of HIV, hepatitis, and other sexually transmitted or blood-borne infections, confidential pre and post test discussion and counseling, access to treatment of HIV and hepatitis, provision of primary health care including wound care and pain care, overdose prevention activities including peer distribution of naloxone and first aid training, referral to drug treatment program as requested. Some of the other form of harm reduction are seatbelt in vehicle, cancer screening, wearing bicycle helmets, using condoms, nicotine patches, and gums. Harm reduction also has some basic principles like some of the principles of harm reduction are a non-judgmental approach that treats every person with dignity, compassion, and respect, use of evidence based on cost-effective practices to prevent and reduce drug-related harm, active and meaningful participation of drug users and community stakeholders in shaping sensible policies and practices around drug use, focus on enhancing quality of life for individuals and communities rather than promoting cessation of all drug use, recognition of the determinant of health and the complex interplay of social factors that influence vulnerability to drug related harm, including poverty, social inequality, and discrimination, empowerment of drug users as the primary agent in reducing drug related harm, commitment to defending universal human rights. Cannabis drug driving test is also conducted by NSW police in roadside with penalties to the users. People who are interested to quit tobacco are encouraged to use nicotine replacement therapy, which are available in the form of nicotine gum, nicotine inhaler, nicotine nasal spray, and nicotine skin patches. These all alternatives benefits the individual with a reduction in consumption of nicotine. Methadone maintenance treatment is another approach of harm reduction where effect of opioid withdrawal is relieved by reducing drug cravings. Methadone medication occupies the same brain cell receptor as opioids like heroin and oxycodone. So methadone imitates the effect of opioids without producing the high effects associated with addiction. Similarly, needle and syringe program provides free access to uh, injecting equipment. Thus, harm reduction practitioners accept people as they are and avoid being judgmental. People who use drug are always somebody's son or daughter, sister, brother, or father or mother. This compassion extends to the families of people with drug problem and their communities. Harm reduction practitioner opposes the deliberate stigmatization of people who use drugs, describing people using language such as drug abuser, junkies, misuser, or social evils creates barrier to helping people who uses drugs. Thus, as per harm reduction practitioners, terminologies and language should always convey respect and tolerance. Worldwide implementation of harm reduction is increasing, as a survey conducted internationally has revealed that 84 countries use harm reduction practices and policy and national policy document references supported regarding harm reduction in 74 countries. And in Australia, since 20 years, Australia is using needle and syringe program as a harm reduction to minimize the risks of the spread of blood-borne viruses, HIV, and hepatitis C. Hence, harm reduction is the practice which helps to the reduction of harm of the drug-related and opioid-related. Thank you. Thank you for listening. Thank you.